So for degenerative disc disease or for any disc problems, a good technique that I pretty much always use in any of those situations at some point is to do this low back traction, where you get the legs at about 90 degrees, take just above the knees, grab with both hands and the traction into that low back, just by simply pulling straight towards me. Pulling straight towards me. The more intense the situation is, the more pain the person is in, the more gentle the traction is. So it might just be a very easy leaning back. I'll just take my whole upper body and lean back. Create a little space in those lumbar vertebrae. It can be fairly aggressive where I'm pulling pretty good, and it can also rock back and forth. Pull on one, pull on the other, jostling the tissue back and forth, looking to get more relaxation, less tone, less hypertonicity in the paraspinal muscles. You go back and forth, you get kind of creative with it. At some point, the person's body is going to start reflexively responding. And when it starts doing that, I simply follow. And then this leg's coming out. This leg's kind of waving back and forth a bit. Just follow. Let it happen. I can support her feet with my legs. Change position if that's what's called for, and in this case her leg's coming out like this, and so I'm getting a better feel for it, a better angle on it by coming under her lower leg. Her reflexes are stopping right here, and so this is a real comfortable position for her. It's got to be, and I can do a little back and forth, maybe a little rock. Whatever feels like it's going to get the most response. If there's a very intense situation going on, the legs might not move at all. They'll just stay right where they are. All right, that's very good. For example, one of the worst situations I had was working on a woman who was in a car accident like an hour and a half after the car accident. She went to the hospital, got x-rays, and there was nothing broken. She came right over to the chiropractor's office I was working at. And this was a comfortable position for her. She could hardly walk. She came, like walking in very stiff. Put her like this, and then all I did was lean on her like this, and it took some of the pain away. Did that for about somewhere between 8 and 12 minutes, and pain came down. We did this for 4 straight days, and after the 4th day, we were a little bit more aggressive with it, and the chiropractor was able to start doing some adjustments. You can certainly follow that up, if it feels good, with a low back stretch. Bringing the legs up. And usually her legs come up pretty evenly. In fact, slightly more to this one. So this would be her right leg, goes a little further than her left. So the left one's got a little bit more stiffness and low back glutes somewhere in there. And so what I can do is just let that rock, and it'll probably soften, and there it goes. She's young and in very good shape, so she'll stretch out almost immediately. But if she didn't, I'm going to exaggerate. Like this leg, say, went real far, and this one, that's about as far as it goes with even pressure. Then I'm just going to look to work that nice, slow and easy, and get it to eventually, ideally, then get them both even. It might happen right away, might take a few sessions. And we can certainly follow that up with a nice low back stretch again. Finish. None of this should hurt, and if it does hurt, then you just back off to where it doesn't hurt. If you got a situation that the person is coming in a ton of pain, you're looking to get into the least amount of pain. Let that settle, and